We'll go ahead and get started. I want to thank all of you for coming to this very important announcement today in regard to making health services more available and more affordable within the city of Hammond.
Another ribbon cutting. I love it. Said I've done so many ribbon cuttings lately. I'm going to have Tommy John surgery at the end of the campaign. So thanks for coming out. This is a wonderful project. We were approached some months ago about the possibility of forming a type of medical clinic in Hammond that would relieve congestion on the emergency rooms. And anybody that's been in an emergency room in St. Margaret's knows that a lot of the cases in there aren't life-threatening. A lot of the cases in there are actually rather routine. And what happens is it's clogging up the emergency room so much that the more emergency situations, you have to wait hours and hours sometimes. It's a huge problem for St. Margaret's, it's a huge problem for us, it's a huge problem for healthcare in the region, because if you're sick and truly need a doctor's attention, you have to wait hours to be able to see that doctor. So when we were approached by this group with a great idea about building a clinic in this part of the city to help Hammond High School in particular, maybe one of the students at Hammond High is sick and their parents can't get them to the emergency room that day, what options do they have? You know, if you can't get in to see a doctor, usually the student's going to stay at home, maybe miss a day of school, 2 days of school, maybe 3 days of school. We got this opportunity now right here in the neighborhood where maybe these students could stop by for a small fee, see a doctor. Maybe it's just a matter of a prescription, maybe it's just allergies, and you know, after maybe a couple hours of seeing a doctor, they can get back to school and reduce some of that missed school time. So it was billed to us as a partnership with the school to help them, and I think that's a great point. And upon further reflection, our campaign, or excuse me, I'm in campaign mode, our team got together and talked about, you know, what could we do to help with the Ophelia Steen Center. You know, the Ophelia Steen Center is such a great project that we've been working together with the Steen leadership and the city of Hammond, and we've always known that there's occupancy in this location, and it's right here in the community, and Hammond High School is right down the street. It just seemed to make a lot of sense. So we approached the doctor, Mr. McKillop, with a change in idea, saying, hey, have you guys thought about the Steen Center? And it seemed like things really took off from there. And it's exciting because not only are we filling a need with the Steen Center and renting out needed space to rent out, it's also fulfilling a need in the community. And I think it's a really feel-good project all around. I mean, anytime you get more health care in a community, it makes the community that much stronger. Couldn't do this without the support from the City Council. I want to point that out. Councilwoman at-large Janet Venez, Councilman at-large Dan Spitali, and of course your 3rd District Councilman Anthony Higgs. Could you give him a big round of applause here? And I'm pleased to be partners with this as far as helping them get up off the ground, and it's up to us to help promote this. It's going to be a great opportunity for the people in the neighborhood. You know, we have cold and flu season coming up, and this is going to be up and running in a rather short period of time. So let's make sure people are aware this is here, and let's make sure it turns out to be a success, because if it's successful, our neighborhood's going to be better. Hopefully our schools get a little stronger, and I know the Steen's going to be better. Their balance sheet's going to look a lot better now because of this as well. So congratulations to the Ophelia Steen Center, and thank you to the doctor and for believing in the city of Hammond. So let's give him a big round of applause.
As the mayor mentioned, Community Health Net, this is actually going to be your 4th facility, correct? So this will be the 4th facility that they have in Northwest Indiana. Again, this is a great opportunity for the community, and the person who can answer all the details and all the questions about how the clinic is actually going to operate is none other than the Executive Director of Community Health Net, Dr. Janet Seabrook. So, Dr. Seabrook.
Thank you very much. Thank you, Mayor. Thank you, honored guests and distinguished citizens of Hammond. I'm Dr. Janet Seabrook. I am a family medicine physician. I am the Executive Director of Community Health Net. Community Health Net currently right now has 3 locations. 2 are in Gary, and 1 is located in Maryville, Indiana. I'd also like to introduce you to Mr. Mike McKillop. He is not only my CFO, but our Director of Operations at Community Health Net. He did a lot of work behind the scenes to help make this dream of mine come true, to be able to provide health services and expand the health services in Northwest Indiana through Community Health Net. I also want to recognize Leslie from Purdue University, one of our true partners in bringing this together. We started, over a year ago, meeting in the Dean of the Nursing School at Purdue conference room talking about where in the world could we locate a health center in Hammond, because we knew that services were needed here. Several years ago, we started to see a trend in our numbers at our Gary office, and when we opened our Calumet office at Calumet High School, that patients were traveling from the Hammond area. About 500 patients were coming from the Hammond area to receive services at our other locations. So we thought, you know, as a community health center with the mission of bringing services or bringing health services to the underserved, why not look at the Hammond community with the hardships that people have getting to the other locations? Why not find a location where we could be in the heart of that area and be able to provide those much needed services to the residents of Hammond directly? So we talked to anyone who would listen to us. We talked to Purdue, we talked to the mayor's office, we talked with the hospital, we talked with the local school district, and everyone was in favor of it. It was just where could it be located. And just here recently, things started moving really fast when we realized that this location would be a perfect opportunity to start the services here at this health center, and then look at expanding those services throughout the city of Hammond, but at least start to get the residents used to coming to this location to receive those services. So it's just been a great process. It's been wonderful working with the mayor's office. It's been wonderful just working with the citizens here, because we actually went around and we asked people, what would you like to see? We talked to parents at the Hammond High School. We talked to the nurses at the high school. So we wanted to know, what are you looking for? We talked with the nurses at Purdue University. What are your needs? What are you being asked to do for the residents of Hammond? We spoke with the mayor's office. What services would you be looking for if we were able to bring this health center here? So it's just been a great effort in all those who've been involved in it, but it's been a wonderful process, and it's even, you know, it's going to be, I believe, a great working relationship, and it's definitely going to be a great benefit for the residents of Hammond. So we're glad, we'll be happy to answer any questions. Mike, you have anything you want to say?
I just wanted to add, we really appreciate the mayor and the city's support. We wouldn't have been able to do this otherwise. This is going to be a federally qualified health center, which means people will be able to get services on a sliding fee scale. It'll also be bilingual. People will have access to prescriptions at a lower cost than they can get through other clinics. So it's a great service to the community, and again, I appreciate the mayor's support in allowing us and facilitating putting this clinic here. So thank you.
Thanks. Just give you all an idea of, so if I was a single parent and my kid was sick and I wanted to get him to school, you'd stop by, see a doctor. How much would it cost for a typical parent to come by?
For the adult or for the child?
For the child.
For the child, right now we're looking at visits for children between $10 and $15 that aren't insured. And we have a program where those children who are eligible, we have staff that will enroll them in Use Your Health Wise, which is the state Medicaid plan. Believe it or not, we have families that don't even realize that they're eligible for the programs. So our health center is a full service health center. So we have programs, when we put that person's information in there, we're able to identify. That's why we ask how much was your household income and size. We're able to identify what federal programs they're eligible for and immediately enroll them in those programs. Provide the service, and then later on when they have their health insurance card, go ahead and bill for that service.
Some of the programs, for instance, are the BCCP program, which is breast and cervical cancer program. Women in a certain age, if qualified, can get free mammograms and free breast exams. Screenings that otherwise they might not be able to get, and in that case could have cancer and be at a higher stage before they become aware of it. Programs with free prescription assistance. So again, as Dr. Seabrook said, because of us being a federally qualified health center, we can offer more services to the community at a lower cost than other private. We're a nonprofit organization.
And the best thing about the Indiana Breast and Cervical Cancer Screening Program is that if we do find cancer, we don't leave you hanging. You're able to get emergency Medicaid, and we're able to send you to the surgeon so you can go ahead and get any procedures performed. that are needed without having any delay in your services waiting to get insurance.
Think about it, we're talking about quality, affordable health care. It's another addition in improving the quality of life in Hammond. We have college-bound, we have home-bound, now we have an affordable health care facility for the residents of Hammond. So, I mean, just again, if you think about all the things that have been going on in Hammond the last few years, the mayor deserves a great big round of applause for everything that's been going on.
I'm extremely elated that the fact that the health center is being provided in my district. The service that it will provide for the community is vital for the nutrients and to move our community forward in regards to health services that are provided throughout the community. Is very vital to make a community move forward. And so in saying that, a couple of months back I had an opportunity to meet with a doctor and Frank Mervan, and this has been in fruition for quite some time. And so I am really excited about the services that it will provide to my community, to the city of Hammond. And again, the mayor, we should give him a round of applause for being a part of this effort in making our community a better place for all the residents in this great city. So again, thank you so much, Mayor, and again, thank you all for being here, and I'm sure the services that this health center will provide to my community will be helpful in the community as well as in our city for the future. And with a healthier community, we can do more in our city. So thank you so much.
And last but not least, I want to call on Paul Walker. Paul is the Executive Director of the Ophelia Steen Center. And as I mentioned before, this facility was built actually as a health clinic, but it's been unused until now. And in January, of course, it'll become just an exemplary part of the community, excuse me. But Paul, if you want to say a few words about the impact that this has on the center, we'd appreciate it.
Thank you very much. Good evening. And you know, there's been a lot said, and I don't want to repeat it, but the philosophy that the Ophelia Steen Center was built for, the name itself, Health and Services Center. And I've been answering phones in the 3 years that I've been here, and people have been calling, and we didn't have the health clinic. And I'm tickled to death to be able to tell them, yes, I'll give you the numbers down the hall. And so it's going to fulfill what the philosophy of the Steen Center was built. And it's bringing that service to the people. So we're tickled to death here at the Ophelia Steen Center. We're so happy to have it, and as the mayor said, we need the money. We still have a mortgage that has to be paid, and I want everybody to remember that. And so we're just so happy to have it here. And you know, I look about it and I see all of the faces out in here, and I see so many people. This young lady here was involved from Purdue. She was involved with the steering committee for the Ophelia Steen Center way back. So we've got a little DNA from a lot of people in this room that's connected to the Ophelia Steen Center, been supportive of it over the years. We've had the black and white ball for 25 years. We got the next one coming up on February 4th. We'd like for you all to be at that and continue to support us with that as you've always done. And so I'm just happy to say, you know, that the health facility is going to be back in here because of the support of the mayor and Councilman Higgs. And Anthony was, before Anthony was a councilman, he was involved in this. Before Janet was a councilwoman, she was involved in this. Bob Markovich has been a councilman so long, I can't say before him, but he's been involved ever since it started. He was there before we were, so he's been around a while. But I would like to say that we do have some of the board members from the board here today. And, first of all, Carolyn Jackson, who is the current president of the community. Cynthia Warner, who is the immediate past president, is here with us. We have our treasurer, Christine Figueroa. She's here with us today. So I want to thank you so much for being here. My nickname is Quasimodo. I'm the keeper of the castle. That's what I do here. And I'm just like Quasimodo was. I'm just the keeper of the castle, just to make sure that we keep the place looking good and running right. But thank you so much for being here. Thank you.
have any questions? Questions? Yes.
Who's gonna get stuck by a needle first, Higgs or McDermott?
Any other questions?
What hours can we expect to be open, Dr.
We're gonna be open 32 hours a week, and before we open January 2nd, we'll have those hours publicized. But
Great.
it will be open 32 hours a week.
32
Some
hours.
evening hours and some day hours, so it'll be convenient for residents.
And actually, a little known fact that people that negotiated the deal, initially, when it was supposed to be another location, the hours were greatly reduced compared to what we're gonna be able to do at the Phillies Teen Center, so
That's
actually
right.
coming here expanded the hours greatly, which turns out better for
That's right,
everybody.
the original vision was 4 hours as a pilot program, but through the work with the mayor's office, we've been able to now expand that to 32 hours direct community service.
Not only that, it was a lot of resources that needed to be raised in
Mhm.
order to make it a reality.
And we're going to make sure that we publicize the location and the hours through the water bills, through the mayor's radio show, mayor's night out, obviously through the local press that's here this afternoon. So we want people to use it. I think, correct me if I'm wrong, Mike or Doctor, but the more people who use it, obviously the more revenues that you have, the more likelihood you'll be able to expand hours.
Yes,
correct?
exactly, and not only expand hours, but put clinics in other areas of Hammond to increase accessibility. And one thing we'll do out of this clinic is we'll give free immunizations to all the children in the school system. And to all the children that live in Hammond that aren't in the school system, and that's important. So there's a lot of services that we'll be delivering to the community without charge, and we'll be able to do it because we now have a location here.
That's good news.
Raise your hand up, you have a question?
Yes, will this healthcare center provide any employment opportunities for any of the citizens in
We
here?
will be looking in the Hammond area. Health centers typically like to hire from within. It's nice to know the receptionist or the medical assistant or the nurse that's taking care of you. Physicians, that's another story, but definitely the staff, we want bilingual staff. We want people to be able to communicate with the patients and the patients to feel comfortable communicating with that staff. So we will be hiring from within the Hammond community.
A little more about the community and community development. It's well documented through the National Association of Community Health Centers that every dollar invested in a community health center has $5 of direct economic development impact in the community. So not only will the community be healthier, the community will be stronger financially. So this is really a win-win.
Alexis?
I had a question. How many physicians will be on staff here, or how many employees will be in this facility?
We will have one physician and 2 nurse practitioners that we're leasing from Purdue University. So we will have a full-time staff. They'll split those 32 hours, but there will be coverage during those 32 hours either with a physician or 2 nurse practitioners.
And the staffing of this clinic was in collaboration with Purdue University School of Nursing. And Dr. Peggy Gerard and Dr. Leslie Rittmeyer is here representing the school now.
Karen, did you have a question?
Yes, I did. You know, some parents work, and I was just wondering if any of those hours include Saturday.
Right now, we start out looking at evening hours, but what we like to do is we look at demographics, we look at usage, and right now we have a Saturday clinic at our Gary office, and we're trying to look at the trends there. But more than likely, depending on how the trends are, we're looking in the future to maybe have Saturday hours.
Doctor, I think it's safe to say that you're talking about hours as late as 8:30 during the
In
week.
the evening, yes.
Right, so, I mean, the idea that, you'll be able to come here up to 8:30 in the evening. There are very few doctor's offices anywhere in the area that you can go that late, unless you're going to the emergency room. So, this clinic is going to make medical services readily available to everyone.
It's also interesting when you talk to St. Margaret's and they know the problem and they're excited when they see stuff like this happening because they realize that this is going to ease their burden. So in the emergency room, they're truly seeing emergencies.
Right.
So.
And thanks to the mayor and the city council, we are in a position to offer 32 hours now, but that's the minimum we're going to offer. Our goal is, through all these, through all our talks, is to expand those hours based on demand. So the more people that use it, we'll be open Saturdays, we can be open evenings, it's all relative to demand. So we, a lot of it's gonna be on the community's interest and involvement in utilizing the clinic and coming to receive services, and then we'll just continue to meet that demand. So if there's a high demand for Saturdays, then we'll meet that demand.
Any other questions? If not, thank you all for coming, and hopefully you come back on January 2nd.
Okay, give them a big round of applause, everybody.